COVID-19 threatens the entire nervous system. Summary: roughly 50% of patients hospitalized for COVID-19 experience neurological symptoms including headaches, dizziness, smell and taste disorders, and stroke, a new study reports. Coronavirus may affect the entire nervous system, including the brain, spinal cord, and muscles. Neurological symptoms of COVID-19 may appear before the fever and cough commonly associated with infection. Source: Northwestern University. A new review of neurological symptoms of COVID-19 patients in current scientific literature reveals the disease poses a global threat to the entire nervous system, reports a Northwestern Medicine study published this week in Annals of Neurology. About half of hospitalized patients have neurological manifestations of COVID-19, which include headache, dizziness, decreased alertness, difficulty concentrating, disorders of smell and taste, seizures, strokes, weakness, and muscle pain. It's important for the general public and physicians to be aware of this, because a SARS-CoV-2 infection may present with neurologic symptoms initially, before any fever, cough, or respiratory problems occur, said lead author of the review, Dr. Igor Koralnik, Northwestern Medicine Chief of Neuroinfectious Diseases and Global Neurology and a professor of neurology at Northwestern University Feinberg School of Medicine. The review describes the different neurological conditions that may occur in COVID-19 patients and how to diagnose them, as well as likely pathogenic mechanisms. This understanding is key to direct appropriate clinical management and treatment, Koralnik said. The disease may affect the entire nervous system, including the brain, spinal cord, and nerves as well as the muscles. There are many different ways COVID-19 can cause neurological dysfunction, he said. Because this disease may affect multiple organs, lung, kidney, heart, the brain may also suffer from lack of oxygenation or from clotting disorders that may lead to ischemic or hemorrhagic strokes. In addition, the virus may cause direct infection of the brain and meninges. Finally, the reaction of the immune system to the infection may cause inflammation that can damage the brain and nerves. Koralnik and colleagues have formed a NeuroCovid research team and started a retrospective analysis of all COVID-19 patients hospitalized at Northwestern Medicine to determine the frequency and type of neurological complications, as well as response to treatment. Since knowledge about the long-term outcome of neurologic manifestations of COVID-19 is limited, Koralnik also will follow some of those patients prospectively in his new outpatient NeuroCovid clinic to determine if neurological problems are temporary or permanent. These studies will provide the foundation on how to diagnose, manage, and treat the many neurologic manifestations of COVID-19, he said. Abstract: COVID-19, a global threat to the nervous system in less than 6 months. The severe acute respiratory syndrome coronavirus type 2, SARS-CoV-2, has spread worldwide, infecting nearly 6 million people and killing over 350,000. Initially thought to be restricted to the respiratory system, we now understand that coronavirus disease 2019, COVID-19, also involves multiple other organs including the central and peripheral nervous system. The number of recognized neurologic manifestations of SARS-CoV-2 infection is rapidly accumulating. These may result from a variety of mechanisms including virus-induced hyperinflammatory and hypercoagulable states, direct virus infection of the CNS, and post-infectious immune-mediated processes. Example of COVID-19 CNS disease include encephalopathy, encephalitis, acute disseminated encephalomyelitis, meningitis, ischemic and hemorrhagic stroke, venous sinus thrombosis and endotheliolitis. In the peripheral nervous system, COVID-19 is associated with dysfunction of smell and taste, muscle injury, the Guillain-Barré syndrome and its variants. Due to its worldwide distribution and multifactorial pathogenic mechanisms, COVID-19 poses a global threat to the entire nervous system. While our understanding of SARS-CoV-2 neuropathogenesis is still incomplete and our knowledge is evolving rapidly, we hope that this review will provide a useful framework and help neurologists in understanding the many neurologic facets of COVID-19. Feel free to share this COVID-19 news.